Hi, I'm Daniel Nyman. On behalf of the Forum for Healthcare Strategists, as well as our colleagues at Kyruus, welcome and thank you for joining us for Launch, Scale, and Optimize Your Digital Self-Service Offerings. Increasingly, consumers want a more connected and personal healthcare experience. As part of that, they want to be able to do more online, whether it's scheduling, check-in, or payment. In today's webinar, we'll examine the current landscape of digital self-service in healthcare. We're fortunate to be joined by three experts on the topic. With us today are Bullion, Clinical Informatics Consultants at Harbor Health, Leigh Bouskila Turk, Manager of Patient Access at Nicklaus Children's Pediatric Specialists, and Deirdre Fenick, Senior Vice President of Customer Success and Support at Kyruus Health. With their help, we'll also explore effective approaches for meeting consumer preference for convenience while also boosting operational efficiencies for staff. A couple of notes before we begin. First, if you have a question, please enter it into the question and answer pane located on the bottom of your screen at any time. Our speakers will respond to as many questions as they can in the time we have. Secondly, we will be conducting several audience polls during the program, so please be sure to participate when those pop up on your screen. With that, I'll turn the program over to Deirdre to get us started. Deirdre?
Great, thank you, Daniel. Really thrilled that you all have chosen to join us here today for this discussion about digital self-service. As Daniel said, my name is Deirdre Fenick. I'm the Senior Vice President of our Customer Success and Support teams here at Kyruus. And I tend to spend my day obsessing about our customer experience, which also means obsessing about your customer experience. To get things kicked off, I'm going to review a bit of industry-based research knowledge, as well as a framework to offer you all as you think about digital self-services within your organizations. And then we're going to jump into the panel discussion with Holly and Leigh. So I want to kick things off by just sharing a bit of baseline data. I think everybody here, because you are a patient, you're a consumer, wants to engage with our healthcare providers digitally. In fact, I'm going to share a little story about myself as we go through the next few slides, as I realize the preparation of these materials spoke to my own experience recently. So what we know is that 80% of consumers will go and look at least two websites to find care. I have some arthritis in one of my knees from a skiing injury from 25 plus years ago. And it's been over 5 years since I had been to an orthopedic specialist to review the progress of deterioration of my arthritis in my knee. And so I was looking for a new orthopod. I went to 8 different sites to search for that care. I did end up finding a physician that met my clinical requirements, was located close to me, and was able to book online. So I'm not a millennial, but all of us, including millennials, are looking to book online these days. And I've completed my appointment, and this organization had pre-visit integrated into their visit process. So I was able to do all my paperwork online ahead of time. And I was also able to pay my bill online. So those are the aspects of digital interaction that I think all of us as consumers are looking for. I recognize that I do spend my days obsessing around care access, but I don't think that this is any different than what we're all doing as consumers every day. Next. And my story goes on. So unfortunately, what also happens, and many of you are dealing with this, is that the investment you have to make to support the structure within your organization means that if you have an open slot, an open appointment, you're probably losing somewhere between $150 to $200 in cost, where you don't have revenue coming in against that appointment. And unfortunately, I was also part of this story. Despite all the technology reminders, I managed to show up on the wrong day for my appointment. I showed up on a Friday morning, and my appointment was on Thursday morning. Human error here. I put it on my calendar wrong. And so I share that with you because that appointment slot, I mean, I recognize the cost that I created in that organization. And what's interesting about this, when you think about the gaps in schedules, is that from a Kyruus perspective, we can see that 1/3 of all appointments booked online are booked after hours, so after the offices are closed for the day, and that 26% of them are for the same day or next day. So, the vision we should have is of somebody sitting on their couch in the evenings, recognizing that oh, now that my workday is over, the kids are in bed, I can think about all the other things I've got to take care of in my life. And, wow, I'm not feeling that well. I think I want to book an appointment to get in and be seen. So we've got a risk in that when the appointment slot is behind us, we lose that as an opportunity to gain revenue, and we have a cost associated with it. And I'll close out this story by sharing that when I did arrive on the wrong day for my appointment, it was about 10:30 in the morning on Friday. And I had never been to this practice before. No names will be utilized here, but I will share with you the waiting room was a madhouse. Like I could just walked in and could feel that the vibe was that people were frustrated. There were folks going up to the front desk asking about wait times. And so that is a reality of our world, that, with the stress caused by turnover of staff and the increase in cost of labor, our teams are challenged, and patients feel that. So throughout this experience, this is all about that patient experience where they start at the front door, but they finally arrive at your physical door. What it influenced me to do, despite the fact that I was standing in front of the front desk staff and had missed my appointment, they were great. They were very supportive. They told me it happens all the time. And when I booked my appointment, I rebooked my appointment. I booked for the very first appointment of a day to avoid the chaos in that office. So I just share that with you as that's the reality, that we are trying to manage in. And before we leave this slide, we do want to make sure we're integrating your guys' point of view as participants. So Daniel, we want to queue up one of our polls before we move to our next slide. So one of the questions we wanted to start with is, where are you in your digital front door strategy? It also gives us a good sense of understanding of who's on the call, and where to focus. Are you just getting started? You're in that strategy building phase. Are you in the midst of a plan that you have already built and you're executing? Or are you now looking for ways to optimize and grow your breadth of outreach to your patients and consumers? And we'll just give it another 30 seconds and let people vote. And then before we move on, we'll just summarize what we've got across our participant land. All right, Daniel, how are we doing on results? Oh, fantastic. All right. So, okay, wonderful to know. We've got a bifurcation here. We've got 44% that are in the early phase, just getting started. We've got 44% that are well executed under their plan and are looking to optimize. And we've got just 13% of you in the middle. Great. Thank you for sharing that. I think that helps myself and the panelists as we go through our discussion. So one more slide, and then we'll jump into our discussion. We've talked about some industry stats. I also wanted to provide this group of folks with a framework to get started. If you're 44% of the participants that are just getting started, we wanted to provide some ways that you can get started all the way and approach it in a crawl, walk, run strategy perspective. And the way I think about these aspects of a digital front door and creating an online digital self-service experience are search, scheduling, and check-in. And as you build across each of these, your knowledge and your learning of what consumers are looking for, particular to your organization, enables you to get smarter and smarter. So let me walk through a few of these. So first and foremost, you want to create a user-friendly find a care experience. Notice I didn't say provider, find care experience, because so much of care today is offered in different modalities. Could be a video visit, could be same-day care, could be care with an APP. But you want to create a user-friendly find a care experience to get started. And with that, target a small, manageable number of providers, a cohort of providers who have a willingness to get their schedule online. Commonly, this is primary care providers. What we can tell about our data from a Kyruus perspective is that 40% of appointments scheduled through Kyruus solutions are new patient appointments. So think about the opportunities you might also have with new providers coming into your organization and the opportunity to fill a new schedule. And then the final component in this first layer of crawl is launch digital check-in and payment. What this is going to do is, number one, consumers will self-service and they will complete it ahead of time before they get to the office. None of us, I don't think anybody really wants the clipboard anymore. Everybody is highly concerned about confidentiality of their payment information. And so the opportunities to put all of that online, a consumer will complete it online, and it will also start to reduce some of the work effort on your staff. One of the common themes I hear across medical practices that I talk to these days are that with turnover of labor, with labor costs being what they are, and the fact that commonly you're having to knit together, somewhere between 7 to 12 different vendors in order to make a consumer experience work, there's just a lot of overhead on your operations folks. And if there's ways to simplify, that will pay dividends for you in terms of stretching your dollar. The next layer, so the walk strategy, is as you've set your baseline, you can start to learn. And so you've created your user-friendly care website. Now know from a search experience what consumers are searching for. And so you can start to consider the care options that you can offer consumers. The search features will also influence your scheduling. So what's wonderful about looking at our search data is we know very clearly, OBGYN commonly is a top specialty searched for in a multi-specialty organization. It's not uncommon that the women in the family own the healthcare decision-making, and you can see that in the search data. And so that then will navigate you into, how do we think about expanding scheduling? We might be in primary care, but now we should expand it to OBGYN, maybe pediatrics. And that's a way to start to grow your primary care specialties then into some of your subspecialties. It's also not uncommon across our search data to see orthopedics and cardiology in multi-specialty organizations be top searches. And that often aligns with strategies those multi-specialty organizations have to maximize their focus on those high revenue producing specialties. Finally, in the check-in process, you can start to add custom content for that check-in process. There's the capabilities of, if somebody is coming in for an annual visit, ensuring that the screener related to social determinants, of their lifestyle are collected. So you can do forms on the fly out to patients in order to cover them. Even if they're sitting in the office and say you've got to do some type of test or procedure, that's another way you can form on the fly to them so they can sign off from a consent perspective. So that's our walk strategy. And then finally our run, like broaden your online reach so patients can find care wherever they're searching. This can include things like video visits. It could include inclusion of your APPs if you haven't included them yet and opened up their schedules. From a scheduling perspective, you can now start to go broad. We've seen customers have great success around mammographies and flu shot campaigns, teeing consumers up for scheduling. And then finally, the ability to check in and actually note yourself as you've arrived as a patient for your appointment without having to approach the front desk. And so that is also a capability that can integrate directly into an EMR to tell the staff, like, this patient has arrived, they've completed their pre-arrival paperwork, we have a credit card on file for them, and they're here in the office, so we can start to figure out how to get them back for care to be seen. So that is our approach to digital self-service. My fondest wish is that this will create fodder for our discussion and questions from you all. And with that, we're going to transition into introduction of our panelists. So Holly, why don't I ask you to come off of mute and introduce yourself?
Hi, folks. My name is Holly Bullion, and I am the clinical informatics lead and the clinical informatics consultant for Harbor Health. My background by licensure, I'm a family nurse practitioner, but I've spent the past 6 years now focused in operations, quality improvement, and clinical informatics. So to tell y'all some more about my wonderful organization, Harbor Health, we're very young. We're 2 years old. We're a multi-specialty practice out of Austin, Texas, which is really, really focused in shifting the health model to a more relationship-based model, patient-centered model with our patients, and shifting to value-based care. So we have 10 brick and mortar locations, 2 mobile clinics, and a variety of scheduling, self-check-in, and intake needs that come with those different spaces and different specialties. And I'm excited to chat with y'all today.
Thank you, Holly. And Leigh, would you do the same? Introduce yourself.
Sure, thank you. Hi, everyone. My name is Leigh Bouskila Turk. I have the pleasure of serving as the manager for patient access for Nicklaus Children's Pediatric Specialists. That is the employed physician group for Nicklaus Children's Health System. As part of the health system, our group employs about 500 clinicians and APPs. We have a multi-specialty practice, so we have 24 primary and subspecialty services across 34 locations in South Florida, all the way from Palm Beach County down to Key West. As part of my role, I get to collaborate with our clinical and our administrative teams to improve our access to care. And a large part of that is optimizing our digital front door. I'm excited to talk more about that today.
Thank you both for those introductions. I'll kick things off. Holly, I wanted to start with you, but could you share a little bit about what brought you to the state you're in today in terms of the digital self-service? What were the factors? What was part of your strategic decision making? Again, remembering a large part of our audience is in the early days of planning.
Right. So Harbor Health, very, very shortly after it started seeing patients, decided to transition to a new EMR. And we'd figured out our growth strategy and the number of clinics that we were going to be building out. And so we wanted to kind of revisit, we have a wonderful in-house product and engineering team, but we wanted to revisit what our vendor requirements were going to be, and starting to look at more at third-party solutions, right? And so a huge part of that initial vendor requirements gathering was, while we were very small at the time, we had 400 active patients, 8 providers between physicians and APPs at the time. We really wanted to do a strong stakeholder analysis of what was working so far. We did not have a strong digital check-in solution at the time. I think we were using Zoom for telehealth. And so the way that we kind of looked at this was, let's gather different stakeholders from different departments and making sure we're not just covering staff experience and our marketing team, but also considering revenue cycle, considering our member experience teams, and really making sure that we had a clear set of requirements of what we were looking for in our solution, because we were anticipating some very, very strong growth for last year, which was 2023, which did come to pass. And so we built that vendor requirements list, and then we started seeking out vendors. And I think that, one of the most important parts of that was having that clear understanding of what were deal breakers for us, what were must-haves, what were nice-to-haves. And looking for, ideally, a solution that could meet all of those requirements, rather than piecemealing our telehealth, our self-scheduling, our visit intake, and our payments, right? Having a cohesive solution was really, really important to us.
Great. Leigh, similar question. Different size organization. You're at a different place than Holly's organization. Could you also speak to how you guys came to address the need for a digital self-service strategy?
Definitely. So we have 2 North Stars. The first is patient access, and we define that as the number of new patients seen within a week. So that metric really gives us a pulse check on how whatever we're doing and what the outcomes are. The other North Star is, of course, the voice of the customer. So we're constantly looking at our Google reviews, our Press Ganey scores, our comments left on those surveys. And a very important and key theme has been, I'm trying to call for an appointment and I cannot get to a person. The check-in process is very lengthy. I'm getting that clipboard like you mentioned earlier. And so as we were seeing this, we figured we need to think about, what is our digital front door strategy? And in our organization, we've partnered with many vendors for that. And for us, that's part of that. Picking that vendor is one, making sure that they work with pediatrics, because that's there's a difference in, of course, the care, the complexity, the level of layer with you when you have a family member involved, not just that patient. And so we looked at vendors that could meet that need. And then now we're kind of thinking through how can they all connect with one another. But most important from that, the press gainies and our outcomes was sometimes we had the availability in our schedule book, but because patients couldn't reach us necessarily, then we couldn't fill that slot. And so online scheduling was something that we prioritized last year. We did a full vendor review and ultimately chose Kyruus because of the ability to search not only to be able to direct book, but to be able to search for your care, type in a condition, specialty, filter by location, type of clinician. All of those things were really important to us, and we're seeing the fruits of our labor right now as we're about 5 months into the project and going live.
Is there anything else that you find is unique about the pediatric space versus, say, primary care, or other specialties with regards to digital self-service?
Definitely. I think we are all under the mercy of regulatory constraints, but I think pediatric has a special scrutiny, and not just that, and it is for the intention of protecting these children, but we find that sometimes when we're looking to enhance our digital strategy, we are at the mercy of regulatory restrictions. So a couple of examples that come to mind are, first, with our patient portal. Many adult organizations, you can go online to their website, you can sign up without login, anything. With us, you need to confirm that that guardian is the right parent or person to be able to get access to that portal. So everything with us has to be done either at the time of scheduling on the phone. We've built it into our Kyruus experience, but also we do have to make sure we're validating that that person is getting the right access, and not just that when they do get access, we're limiting the visibility by age group. So that requires a lot of complex IT builds. So we can't quickly turn on a button and give that quick access. Aside from that, with our pre-registration tool, we've had a different organization and vendor a couple of years back support us with that. But we tried to actually implement like a pre-visit clinical screener. And because the tool was made for both adult and pediatric health systems, we're still working through the limiting certain clinical information being shown to the parent, where they should not be able to see that. And so we actually had to limit that clinical screener for a certain age group, and it de-standardized our process and also made a different experience for the patient and family based on the child's age. And it affects the visit length. And so we've had to consider those things throughout the process, but we get to serve a lot of patients and families and as a unit. So that's been very rewarding, but definitely comes with a set of challenges.
You hit so many topics we could dive into, right? Like the desire to standardize, right, for operational efficiency. I picked up on what I was referred to as we all desire the innovation, but we're in a highly regulated industry, so it's weighing the innovation with the risk. A couple of these I think we should come back to in our discussion. But Holly, in comparison to Leigh, focused on pediatrics, you've got a growth organization. And so how is building this strategy around digital self-service enabled you to reach your goals?
So we ended up, we had 30 primary care providers come over to us with a single launch date last summer. And that was quadrupling our number of providers. We were expecting tens of thousands of patients to transfer over, and majority adult primary care patients, but absolutely some pediatrics as well. And so, when we looked at the slides earlier and talking about kind of the search, crawl, run, right? We had to prioritize what we wanted to do first. And the top priority at that time was that we needed to give patients an easy way to schedule. That was 100% what we had to do first, right? Because if patients were going to be calling us and on hold for an hour with a very limited number of call center employees, we were going to lose those net new patients. So being acutely aware of the fact that that we were a small organization that was about to take on some significant growth, we had to consider of the patients that we were expecting to come over, what were their needs going to be? What were their demographics? And so for Austin, Texas, how many of our patients coming over were going to be primarily Spanish speaking? Austin, Texas population, there's a school for the deaf, there's a school for the blind. And so we have a lot of deaf and hard of hearing patients, blind patients, and there are some digital solutions that are going to work really well for those patients. And there are some that are not, right? So considering as we were looking at our needs, what are classic traditional pen and paper processes and call processes were going to be as well, right? Because you want to make sure that those all align. Also, Austin, Texas, I think is number 3 city in the US for LGBTQIA identifying individuals. So, making sure you have to balance, especially when you're looking at scheduling and pre-visit solutions, asking too much of a consumer is going to have them end the process, right? And so that balance between what are the absolute wants and needs for information we want to gather to ensure that patient has a positive booking and intake experience versus where are we going to trigger drop off? And so, there's nice to have. So what are your pronouns? What is your sex assigned at birth, legal sex, gender identity, language, gathering information, balancing where that was going to show up in the process, and also how frequently it would recur for future visits was a really important balance for us to strike. And so we prioritized scheduling. We knew that insurance was something that we wanted to gather because we were still in the midst of credentialing all these providers and making sure that they were in network for these patients and that they were scheduled once that credentialing was complete was really important to us. And so we spent a lot of time with Kyruus determining what are the required fields for scheduling, and we had a whole marketing campaign to ensure that patients who are coming over specifically looking to transfer alongside their provider had that quick QR code that went to their direct book page that surfaced those appointments and surfaced it in a way that made sense. These patients were not new patients of these providers, but they were new patients for us. So making sure that they were being booked correctly and that we were using that really accessible language on the scheduling website was really, really important, and not overwhelming those patients who felt very much like they were existing patients for those providers in the intake process was an important balance to strike.
Yeah, that's quite a journey, going from 8 providers to nearly 40 very quickly. One of the things that struck me as both of you have been speaking is that, Leigh, you used the North Star. Holly, you said, we made our first priority easy to be schedulable online. And recognizing that our participant audience, we've got a good mix of people that are early in their mapping strategy, and we've got people, participants that are pretty far along. I guess, could you speak to one of my observations working with many customers is a trend I see on customers that are successful is they set I'm going to use Leigh's term, a North Star. And the word both of you have used is we. And so could you just talk a minute about aligning the interests internally, both like the clinicians, administrators, financial? Could you just talk about that for a minute? And was that part of your success you've achieved so far, having everybody aligned? Leigh, do you want to take a shot at that one?
Sure. The first hurdle is getting our administrators to financially support our investment in either online scheduling and the other vendors that we have implemented, but I'll focus on Kyruus and online scheduling. That was, for us, it was important to quantify what is our return on investment. We took the very high level overviews. We identified how many patients were calling in to the call center. We kind of looked at abandoned calls and then took a very, very rough estimate of the number of patients that would end up going through online scheduling, and conservatively predicted how many patients would come in as net new to the health system if we offered online scheduling. And that helped us quantify about what the return on investment would be. From there, I think the biggest challenge was actually getting buy-in from our clinical teams. I personally would lead discussions with every single division director. And if the division director decided to include the rest of their clinical team, we would meet with them as well. We talk through what Kyruus can offer, why it was important to our patients and families. Keeping focus on that mission was essential for these discussions. And then as different challenges come up, we take mind of it and take note and try to find ways around it. A lot of our clinicians were worried about patients just going in online, booking an appointment that they didn't really need, or booking an appointment with a clinician that's not right for their care. So part of our strategy as a result was we actually surface in the search experience. If a primary care can treat that clinical condition, they bubble up first. And if an APP can treat that condition, then they bubble up first as well. And so that's actually helped us navigate the right care for the right patient at the right date and time. And that was really helpful, just partnering with the clinicians on that. If we did not meet with them and we just turned it on, I can almost guarantee you I would not be here and we would not be as successful as we are. I'll pass it over to Holly.
Yeah, before Holly jumps in, it's the triangle I constantly see folks like yourselves balancing are the patient experiences on one corner, the clinician experiences on the other corner, and revenue and operational finances is in the third corner. And so it's this triangle that you've got to balance of different stakeholders.
100%. I could not agree more with Leigh and you also, Deirdre. So I think that it's really, really important, like Leigh mentioned, to be including everyone, but even in the initial vendor requirements gathering pieces, right? But also taking folks' strengths and where they find meaning in that process and making sure that they are part of that build out, piloting and iteration. I think one of the biggest things, one of the biggest messages that I can provide when it comes to digital self-service is making sure that you're collaborating with a vendor or internal stakeholders who can iterate easily, because you are going to make missteps, guaranteed, right? And so being able to make changes and listen to that stakeholder feedback, I think some really good examples of how Harbor, ensured that we were having a positive experience with our clinicians is they were A, heavily involved in their schedule creation, and B, when we were deciding, what those one-to-one appointment types, what their reason language would be from a patient-facing perspective, making sure they were a part of that process, and also ensuring that, we had all of their, age ranges seen correctly, the different procedures they were all comfortable with performing, the different visit types, making sure they were involved in that language and that mapping, and that they were performing some QA on that mapping before it went live. And then we have amazing front desk specialists and our contact center folks would provide feedback from, we still have our appointments scrubbed a couple of days prior to ensure that they were scheduled correctly, and patient feedback about this language was confusing. I didn't realize this was a Medicare annual wellness visit appointment. I should have booked a commercial annual wellness visit appointment. And there's just these little misfires that are going to happen, but having that open feedback loop and really iterating consistently upon that is just so important. Also, just little things like timing. When is that pre-visit link going to go out? And does your billing, RCM team, are they verifying copays prior to that link send out date? Because you don't want patients paying copays that they don't need to and having to trigger refunds, et cetera, right? So making sure that you're involving those right people in that right points of the process is going to involve a lot less revisions in the future, right? But being open to that feedback and those revisions was really, really important for us as we ended up the month after we went live with our scheduling for our 30 new providers. 40% of our appointments were scheduled online, which is outrageous. And it was just a huge alleviating factor for our front desk folks and for our contact center. And we just continue to improve it week on week and month on month.
Well, I'm sure our participants can appreciate what you're saying. You both describe yourselves as change management ninjas, right? There's so much operational change. One of the things I thought I just wanted to double click for our audience, Holly, was you can find a vendor that can help soothe concerns from the clinicians, right? While online scheduling is becoming more popular, it's still in its early days. And often I do hear clinicians, they are worried about not seeing the right patients or having their schedule overrun. And as Holly described, you can apply that crawl, crawl, walk, run strategy. You can start with a particular visit type on certain days of the week. And so just audience, I just wanted you to know that there's those capabilities there. But that said, you don't get to what Holly just described, which is 40% of appointments booked online without, really iterating and all buying into the process. There was a question from Lindsay Hastings, one of our participants. I was just curious if either of you have a reaction to it. It's what value did you put on a patient diverted from your call center to online scheduling? Any thoughts there?
Can try to answer that by saying when we initially tried to put a monetary value on this implementation, we assumed about 10% of the total visits scheduled would be through online scheduling. Since implementation, I'm happy to share that we're at about 8%, and we're still not, we've took a phased approach, so we're not even at the final phase of online scheduling. From there, we just took the average revenue from a visit with downstream effect as well. And that helped us quantify the value of online scheduled visits versus the time spent taking inbound calls and what the FTE savings on the call center side would be. I hope that answers your question, though.
I'll add a little bit of color, although I know we have a mixed participation audience, and please realize this is data that's been shared with me by healthcare organizations, but I've had at least, I just think it's interesting because I have more than one data source. But I would share with you just through crowdsourcing and talking to different customers, larger healthcare organizations have said to me that they believe the difference in cost of an online appointment versus a scheduled appointment is the difference between $3 or $4 or somewhere between $30 to $40. So again, there's a tremendous savings in there. Again, scale could be different. I'm going to use the Weight Watchers statements. Results may differ based upon what you put into the program. With that, both of you have started to hit upon this, Holly and Leigh, but could you talk a little bit about that evaluation process? Maybe Holly, we'll start with you because you were mentioning it in your last statement. Like, what was important when you were looking for a vendor?
And so we, like I mentioned, we were looking for scheduling, intake and payments, and telehealth, right? And so that we were looking for all three, and ideally, if all the marks were hit, getting that from a single vendor. And the way that we went about that, like I've mentioned a little bit briefly, was going to those different stakeholders and different departments and gathering their must-haves and their want-to-haves. And their absolute no-nos. So I think absolute no-nos are really important, right? I know that sounds very challenging, but I mean, truly, that's like, what is your absolute no-no? What is a 100% deal breaker? And I think that, oftentimes, I think that patient-centered clinical decision support, which is what digital self-service is at its core, right? It is so important to think about the member experience, but sometimes we forget about the staff experience. And so one of my big areas of focus when I was starting to build out this beautiful spreadsheet was the check-in experience and really ensuring that we're actually saving our front desk folks time. So what are the time crunches? And you can do a time study with your staff and you can see what they're spending, per patient most of their time on. Is it scanning the insurance card and the driver's license? Is it collecting that copay and the card reader having a moment? And really diving into that. And then how are they, depending on your EMR, your EHR, depending on which acronym you prefer to use, how are they interacting with that? And when you're looking at, demoing the vendors, you want to actually see how this looks in the EMR and how they're going to experience that. So an absolute deal breaker for our organization was having that check-in process or dashboard be on a separate tab. My staff have got too many tabs open as is. Like, this needs to be fully integrated into our EMR. We want to see it, pop up in the appointment note on that homepage stating that the pre-visit was complete, or it's partially completed, or it's not been opened, or was the copay paid. we want to see all that within the EMR. And so there were some very big vendors out there for intake that are, very well known, and they're not fully integrated. You have to have a separate tab open. And that was just a deal breaker. And so that actually immediately cut out a few folks from vendors from our intake requirements gathering process, because that was not something that was going to change for them anytime soon, right? On the scheduling front, like I mentioned earlier, what's the required fields that we want patients to be able to complete? What customizability when you have a very, especially multi-specialty care, a very wide range of providers and age ranges they can see and procedures they can perform. Are those vendors going to be able to really surface up one-to-one versions of those visits and give you those age range validations, so that a newborn isn't put on the schedule as someone who only sees 12 plus, right? You need to look at your organization and the variation between your providers and your visit types. Maybe you have 50 visit types, maybe you have 5, but those 5 are huge umbrellas. And so you still need to get into the nitty gritty. You want to make sure that that vendor can match your needs for what you're surfacing, because there's always going to be a user error rate with no-shows or cancellations or reschedules. But again, you're trying to keep that to a minimum. So making sure that you can customize your solutions to your workflows is just so important.
And Leigh, is there anything you would add there?
I would just add that experience is everything. We looked for a vendor that worked with our EMR, worked with pediatrics, and worked with many health systems. They can bring best practices to us that helps us best implement this new initiative and ongoing. And we found that in Kyruus. It was important for us, like Holly was saying, the age validation, the different screening tools to make sure that that patient is getting to the right clinician, especially as both of us have both primary care and specialty care services, and in a different array of modes: telehealth, in person, urgent care, all of that fun stuff.
Well, great, thank you. I think we're going to launch another poll for the participant groups. This question we have is about your journey. Or maybe it's not. Okay. All right. Sorry, just gonna have to adjust it. So what self-service capabilities does your organization currently offer to patients? Select all that apply. Bear with me as I juggle between questions here. Thanks for your patience with me. Again, we're looking to see what self-service capabilities that your organization might currently offer. Do you offer a user-friendly search experience? Do you offer online scheduling? Do you offer digital patient check-in, digital payment? None of these, more than these? We'd love to hear from all of you what you're using today. And we probably will wrap up the poll and have the results here. Oh, fantastic. Okay, so 1 and 2, online scheduling, digital patient check-in, 67% and 56%. Then we've got a user-friendly search experience, digital payment in 44%, none for 22%, and part of the participant organization has even other tools that they're using. Okay, fantastic. Thank you for sharing that information with us. Knowing what our participants are using, Leigh, maybe I can look to you. Maybe we'll talk a little bit about expansion and optimization. So based upon what you've attained so far, what do you now think about in terms of like the next set of challenges to keep the website fresh and constantly, expand and push the boundaries on online scheduling?
I think more than just online scheduling, what our next step is making sure all of the systems sort of connect and speak to one another. So once I schedule my appointment with the online experience right now, the patient and family gets an automatic email confirmation. But now what's next? How does that trigger the intake process? And from the intake process, what does that look like for check-in? And then post check-in, how are we ensuring that if a patient wants or family wants to call us back or communicate with that clinician, how are they doing that? So connecting to that patient portal. And so looking at that digital front door and that journey for the family through a digital lens, that's where I think our opportunities are, and we'll be focusing on that. As far as online scheduling, I'm very proud to say that we've had about 900 visits scheduled online without marketing efforts. And so as it relates to online scheduling, we'll definitely be focusing on educating the community on having that tool available. We actually like using it, and I would recommend that others think about other ways to use it. So we're giving our Kyruus experience to referring clinicians in the community. It's a great way for them to type in that condition and see who in our practices treats a certain condition. And not just that, where do they practice? So currently, I will put us out there. We give out like an online, like a printed manual basically that tells you which clinicians and specialties practice where. But that gets outdated very quickly as we're dynamically moving our clinicians around. And so the Kyruus experience at least gives you everything as up to date as possible. And even there, if you have a patient that you want to refer and it is an online schedulable experience, then go ahead and schedule it on the spot. There's no need to call, there's no need to follow up. And hopefully you'll get that appointment quickly enough that the patient's not likely to not show, and we can really give that care to them throughout the continuum, not even if they're originating from our primary care, but also from the community and from our specialist to our specialist. So definitely other use cases that we'll be focusing on.
Just a follow-up question, because the 900 appointments, without marketing, was that, was there some level of awareness in office as patient came in, or literally these were just consumers that hit your website and realized, oh, I can now schedule online, I'm going to go ahead and do that?
Yeah, we briefly told our team, but because we decided to take a phased approach, and the reason for that is we wanted to test it out the waters and get that feedback along the way as we move toward more quote unquote complex specialties. So we started with primary care and 5 other specialty service lines. From there, the second phase was including more complex specialties, but APPs first. And then on the third phase, we have our more surgical specialties, physician level online scheduling. And so with that, we didn't want to confuse consumers by saying, here you can online schedule, they go to our website, and not everyone is online schedulable. And so we will have slowly told our staff that online scheduling is available, but we're waiting for that last phase to be able to fully market it and build that trust with consumers that you're not just going to go to our website and get concerned or frustrated when you can't schedule for the appointment you're looking for.
Great.
So very, very organic.
Yeah, I was just going to share. I mean, I see it too when I look across our data. In organizations that are taking the crawl, walk, run strategy, you can see in the consumer data, consumers looking for online scheduling, right? So clicking into provider, realizing there's no online scheduling, backing out and going to the next provider. So really powerful insights. And Holly, can you speak to maybe the same question, like at 40% of your appointments currently online booked, like what's next for you all?
So that was back last summer after this big initiative with rolling our announcement out that we were getting these new providers. We're in the teens right now, but we've set a target of getting back into the 20-25% range for this year.
Yep.
And so actually this is very, very similar to what Leigh was talking about, was still being in the upper teens is significant, with the fact that our sheer volume of appointments has significantly increased since last summer. But our focus had been all of this time with the marketing we were doing was getting these transfer new patients over. But these net new patients were still booking online with us without any real marketing. We have a beautiful website and it links very nicely to the Kyruus scheduling piece and the provider profiles match and all that good stuff. But now we're looking at, okay, what can we do with our website and with our marketing for patients who are just interested in Harbor, not interested in transferring to a specific provider, right? And so we have some very kind of generic clinical keyword search terms right now for our providers, starting to really refine that and making sure that we're easily surfacing up their next available appointment or our next steps. Like I mentioned earlier, we have a wonderful marketing and in-house product and engineering team. Having a vendor where you can actually leverage their API so that you can be surfacing some of that information from your vendor in different ways and incorporating that into your website, if you have the team and the resources to do that, I think is a really important level of optimization, which we're working on at Harbor right now.
All right, fantastic. Panelists participants, if you do have any questions, please feel free to submit them in the question panel or in the chat. We'll keep an eye on them. And I'll keep going for another couple questions before we wrap up here, unless panelists, participants have questions. We've covered a lot. Can you talk a little bit about data and how you use data to iterate, right? So what's come across to me as both of you have been speaking today is that if you don't have your Six Sigma black belt, you probably should, right? You're very operational, lots of change management going on. And we're in a business where data talks. So how have you used the data from the Kyruus Health tools to inform decisions that you've had to make with regards to maybe your next phase of focus, maybe changing something? Hey, we saw consumers get stopped on this page. We want to do an edit here. Leigh, maybe I'll ask you to take that one.
Sure. So the first thing we look at is those search trends. I love to see what are patients searching for. And surprisingly, I thought they were going to be more searching for specialty. We've actually seen most of our consumers search for condition. And that tells us, first of all, what are patients searching for? If it is a service we offer, how can we guide them there a little bit better? So a most recent example was a lot of patients were searching for orthopedic injuries. And because our primary care is that first gateway to seeing certain treatments, we had to check that the clinical keywords built out for the primary care was accurate enough. Like, for an orthopedic injury, if it's acute, should that really just go straight to orthopedics or should it go to primary care? So we've looked at those search trends to adjust what clinical keywords are built for each clinician. Second to that, we've looked at the actual appointment trends. So the Kyruus dashboard does a great job of telling us how quickly are patients getting in, what does that availability look like? And we have that data on our systems and reports separately, but it's been helpful to see it through the Kyruus lens because that is what patients are experiencing and seeing. And then finally, just going back to that search trend and the specialties, we do have very complex specialties, specifically in neurology and neurosurgery, where those kids usually go through some sort of screening and intake process. So if we cannot do online scheduling because of the complexity of care and the types of questions being asked, how can we start to introduce little tidbits of it? So actually one of the practices that we were able to do online scheduling for that historically has not with psychiatry. So the new patients still go through an intake process through the practice, but there's an online request form. You can actually schedule your follow-up online without having to call in. So based on those search trends, we've been able to say, this is what's important to consumers. Go back to that specialty and that clinical leader, explain that data, and then work with them to find little tidbits and ways to improve our digital front door and ultimately allow patients to online schedule.
You've hit upon a couple of my favorites. I'm definitely a big fan of the search results. What are consumers searching for? That can help drive iteration. I also, for where you are in your journey, where you said you hadn't done much marketing, I think you'll be it's super interesting to watch some of our other customers do a campaign and watch the appointment volume drive up for a period of time. So particularly around organizations that have done things around flu campaigns, around mammography, you can see the impact of that outreach directly to consumers having an impact on the appointment scheduling volume. So that's great. Holly and Leigh, we had a question come in, and I think we've got some time. So the question is, have you found maintenance to be burdensome? Like the question is like wondering how to best manage content accuracy and real-time changes as provider preferences and schedules do change frequently. And maybe Holly, maybe I'll tee this one up for you because you went through rapid growth. And so there's a part of just dealing with rapid growth, but then that's the process of dealing with 40 different provider schedules and how they evolve and change on a regular basis.
Absolutely. So one of the things I love about Kyruus's solution when it comes to scheduling, right, is it's pulling the schedule directly from our EMR. So any changes that are happening just generically to that schedule, to the appointment type servicing, to the time, etc., Kyruus is just getting that automatically. So there's no redundant work that's having to happen. Now, let's say a new appointment type gets added. or a provider's, age range, scene changes, or what have you. One of the things that I absolutely love, I'm a very techie person. I will happily work in Sheets all day, is that for example, right now I go onto the Kyruus dashboard, and we had a massive 2024 start of the year schedule change for all of our providers. We were getting them all on 2040s because some of them were on 1530s and what have you. And I just went to the Kyruus dashboard. I downloaded a sheet called Provider Bulk Edits. I made the changes. It took me all of 3 minutes. I uploaded it and it was working just instantly, right? So having a vendor where you can have that access if you so choose to make those changes by yourself, I think is so important, and making sure that when you're, demoing vendors, that they can show you around that dashboard and make sure that it's easy and that you don't need to be a programmer to make these changes, right? That it's accessible for the people who are going to be in charge of, making those changes, I think is so important. And so, yeah, that user interface experience is huge, but we are, getting new providers frequently. Schedule changes happen frequently, and the fact that the things that need to be in the EMR can just be done in the EMR, and then the things that are just going to surface to the patients via self-scheduling can be done in a really easy way, either individually or in bulk, is huge. It's so important. And I think that's something to be very specific when you're looking for new scheduling solutions to ask about, because that should not be burdensome. It should be simple.
Thank you for that. And I will also just share, where Kyruus Health started was around provider data management. So we scale up, depending upon the size of your organization. One of the things that we believe is a differentiator for us is our ability to aggregate provider data into a single source of truth. And so organizations like Leigh's and Holly's, differ in size, differ in levels of different systems that are providing inputs into provider data management. But I will share an average Kyruus customer has at least 3 data sources coming in just to populate their provider profile. But that can scale up. We also have customers that have, 20, 25 data sources. So there can be, for that question that came in, there can be a level of complexity depending upon the size of your organization and the disparate setup of your provider data. That Kyruus can help you with organizing so that you can get to this point of creating a digital front door. So thank you for that question. I know we're coming up on time here. So, number one, Holly, Leigh, thank you so much for all that you've offered us here today. As we close out, any final words of advice to organizations? Leigh, you want to take that one?
Yeah.
Okay.
Listen to your people. They will give you the best advice, feedback along the way. I spent a lot of time shadowing our clinics, understanding the current scheduling process. And for those who, I know a lot of you have already established online scheduling, which is absolutely amazing. For those who have not, definitely take the time to think through what that schedule build should look like. For us, it was beneficial to not create separate visit types for online scheduling, but treat it as if the patient calling in or going through online scheduling should have the same access and availability. That said, though, we did the pre-work to make sure that each clinician's template was built in the right way. The visit links were right for how they wanted to practice and meet their productivity goals. And then also that we were kind of trying to keep access open with as many open slots as possible, but recognizing that there are some times where at the end of the day, if a new patient takes an hour and you're putting them at 4:30 p.m., that might be a long end of the day versus putting that follow-up slot at the end of the day. So we thought about that before even going through with online scheduling. And that was feedback that we got from listening, shadowing the clinic. We even have a dashboard that looks at how long between check-in and to check out, and then how many appointments there are a day. So listening, but also using the data to validate what we're hearing. So definitely go through that listening piece, and then also don't be afraid to challenge vendors to think about new ways. We had an amazing project manager that helped us implement this, and whenever we hit a roadblock that we heard with many vendors that we couldn't do this, we would say, but can we do it like this? And then the vendor would take it back. We'd hear back in 2 weeks, and suddenly we could do it like that. So don't be afraid to think creatively about how to change something or optimize it, because at the end of the day, won't just help your organization, but hopefully others.
And Holly, I'll just wrap up with you. Any final words for folks?
Just here nodding enthusiastically for
Yes, you
everything
are.
you're saying.
Yes, you are.
I think that the other thing I'd like to add to that is I think that a lot of organizations, we do fabulously involving all the stakeholders and the boots on the ground for an initial implementation, but we don't do so well about it when we're making changes and iterating after go live. And so I think that even the smallest change that you might make to a workflow is just so important to, because leadership has a habit of making those decisions, just to not have any assumptions and make sure, you know, that you give some notice on a change rollout. And I think you will often be surprised at some of the obstacles that were not considered. So stakeholder involvement from design through deployment and revision, I think, is just so important.
And I'll just wrap things up here by saying I think what both of what Leigh and Holly hit upon is critical. You know, particularly what speaks to me and when I see in working with our customers here at Kyruus is building that North Star and setting your vision of where you want to get to. Because I recognize healthcare is complex and it's sophisticated, and we are juggling between we want innovation and we've got to manage risk. So really, I would encourage you to set that North Star as these women recommended, get the buy-in across your organizations, and like them, you too can be successful. So greatly appreciate Holly and Leigh, you joining us. Participants, thank you so much for being here and asking questions. And if there are any questions we didn't get to, we'll make sure to follow up with you individually. But just want to say a broad thank you to everybody that invested their time with us on the topic of digital self-service. And we'll see you next time.